Well, in the context of the European health data space announced last year, how secondary use of health data may accelerate scientific research, work on new trends, how to guarantee ethical data processing based on social trust and the culture of data sharing. We have analyzed the European strategy which has a section on future healthcare. My name is Artur Olesch, and together with my guests, we'll try to address those questions. The role of healthcare will be growing rapidly, but with data, we'll be able to swiftly diagnose patients, improve and accelerate scientific research, develop new digital services, prevent diseases. We also need data to feed artificial intelligence-based solutions and assist patients' health decisions. Data, often referred to as most valuable assets, belong to patients. I'm talking not only about medical records, but data generated by wearables, by wristbands measuring our physical activities, and collected during medical tests. In 2019, more than 30 million wearables were purchased by consumers. And this is heralding a brand new trend in medicine. Patients in the future will have more health data about themselves than the healthcare systems. And most data will come from non-traditional sources. They will account for the majority of information available to support prevention. The new document towards trustworthy health data ecosystems presents guidelines on ethical collection of data that can be reused by third parties. It's much easier to develop a new technology than change the public attitude to use of data. Let's hear Jana Snipu, responsible for the report, has to say about it.
Beyond the obvious. That was the main motivation when we started writing this working paper together with rounder international experts at CITRA, named Towards Trustworthy Health Data Ecosystems. We wanted to challenge ourselves to think a little bit beyond this system-generated data. Of course, we understand that there's still lots of work to do when we talk about reuse of data for scientific research and innovations. There's need for a common code of conduct, more coherence in interpretations on GDPR at local level. But still, if we want to create more sustainable healthcare systems for the future, more resilient systems, we need to expand our thinking and be prepared for the future. So technology gets embedded in everywhere. And we need to have better tools to enable data gathering, but also to rein in the technology and make people more understandable about their digital futures. Otherwise, we cannot maintain trust, and that's very crucial if we plan to create data-driven services for healthcare and enable people to be co-architects for their own health. So we are calling decision makers to have more active dialogues together with industry. We are asking individuals to demand for fair services and user-driven services. And thirdly, one of the key messages in the paper is that companies should start be more considerate about the voice of society. So stakeholders, shareholders, customers, employees are important part of the shareholders at the moment, but there's more and more also this need for understanding and integrating metrics for more transparent and sustainable data usage, and that's especially relevant when it comes to the health and well-being data. So let's work together for the fairer future in Europe.
W usługach opartych na danych kluczowymi priorytetami są przejrzystość, zaufanie i możliwość wpływania.
So transparency and trust are the key. These values, which are deeply rooted in Europe, should lay the foundations for future digitization. We have to protect the privacy of users anytime and anywhere. We should also process data in ethical purposes. To develop new digital services, such approach will ensure complete interoperability, which is essential to use and tap into the potential of big data on a wider scale. In 2020, the European Data Strategy was published by the Commission, which applies both to the public and the private sector to give the competitive edge to European economy and healthcare system. This is essential because the economy of the future will rely on the availability of data. The European data space is an ecosystem facilitating exchange of data between different market players. So processing data for original purposes and secondary purposes, such as scientific research. So these are economic data or health data. The European health data space will be based on 3 pillars. A strong system of data governance, rules for data exchange, data quality, strong infrastructure and interoperability. Can Europe become the leader in application of health data? This is not going to be an easy task, but we have strong foundations and we have to improve interoperability. We need to introduce standards for data exchange. Currently, data are silos and fail to ensure the safety of data processing for customers. This breeds the risk of digital inequalities. In addition, the current pandemic has made the society worldwide realize that access to information is the key in managing health risks and prevention of diseases, including the pandemic. The document presents a number of key factors and key guidelines. The first one is development of cross-sectoral models for application of data. For example, data on the quality of a lifestyle which overlap. The second factor is development of a scalable architecture of data markets based on aligned principles put together by the private and the public sector to guarantee to customers of digital services the ultimate privacy of their data. Promotion of data usage must be continued by implementing an incentive system, long-term human-centric planning of data space based on European values. It's also important to encourage healthcare professionals to educate patients and consumers. This document was developed with contribution with Bogi Eliasson, who's the co-author of Nordic Health, which puts the stress on usage of data for prevention in health. Let's listen what he has to say.
The philosophy of the digital infrastructure, digital functions, and data is very important. Here we need to have a focus on interoperability. We also need to have a focus on anti-lock-in. Then we also come to the person and the system. In regards for the person, there needs to be a value for the person of sharing data, so it should be accessible to the person in order to live better and have better treatments when that is necessary. But we also have to have more sharing with the system that can work with the data and make it better. What is more important on a practical level is how do we make it easy to share? How can we also merge data so we both have clinical and research data in same quality and for same use? On that part, for the person to share, as said before, it needs to be beneficial for the person, but we also need to secure that there is no future possible harm. So just like we have human rights in different ways, we need to articulate better in the digital space that a person who shares data for the betterment of society and of course for the betterment of themselves, we need to ensure that that cannot be used against them in the future. So we need to rethink what does that mean? The protection against abuse from criminals, abuse from state, and abuse from commercial entities. How do we work with that, and how do we secure the person in it?
So the international non-profit organization My Profit wants to empower individuals to self-decide on the usage of personal data. It puts the focus on just digital society where exchange of personal data is driven by trust and sustainable relations between individuals and organizations. I asked Karolina Mackiewicz about it.
My Data Global to organizacja międzynarodowa z siedzibą.
Data Global is an international organization located in Finland, and it advocates safe and ethical provision of personal data, provided that an individual is in full control. In English, we call it human-centric approach to personal data. And we are analyzing what elements should be looked at in order to ensure more ethical disclosure of personal data for secondary purposes in healthcare. In order to achieve this, we should first of all increase the awareness of the society when it comes to the value of personal data and the benefits of the processing. This data can be used for research purposes, for development purposes, and in order to plan better social policy and health policy. Secondly, it could ensure, in terms of technology, legal aspects, and practical conditions, ways to ensure safe and ethical disclosure of personal data under full control of an individual concerned. We should also increase public trust in public and private organizations through better practices and greater transparency as to what personal data is collected, processed, and used. In order to improve the use of data in the economy and in the healthcare, we need to prepare guidelines for both private and public organizations. There is no space for compromise there, because without social trust, without credibility, it would not be possible to adapt technologies, and success will only be possible if citizens and communities are empowered to become agents of the digital transformation. I would like to encourage you to visit our website and to look through this document, because it speaks volumes about our recommendations and our ideas based on the experiences of Nordic countries and international experts' opinions as to how such systems should be built. Thank you very much for your attention. I hope I've been able to present